Good afternoon. Thank you for joining today's Engaging Families Through Pre and Post-Release Learning, Peer Learning Exchange. My name is Alexandria Hawkins, and I am a policy analyst at the Council of State Governments Justice Center, and I will be moderating this session. Okay, next slide, Ariel. So to give you an overview of today's learning exchange, we will do introductions to the Council of State Governments Justice Center and the presenters from the Center for Children and Family Futures. Then we will participate in a grantee roll call before receiving a presentation from our presenters. After the presentation or discussion period, we will we will take part in a discussion period, and then we'll provide resources. At any time during the session, you can use the chat box at the lower right-hand corner of your screen to ask any questions, and we'll keep a running list of those questions. And at the end of the session, we'll do our best to get through as many as we can. And we can follow up by email for any questions that have not been addressed during this session. So now I'm going to turn it over to the team for the Center for Children and Family Futures for them to introduce themselves.
Thanks so much, Alexandria. Welcome, everyone. Welcome to this third learning exchange. We're really glad you're here. See some familiar names, and I think some names that I don't recognize. So hopefully we have some new folks today, and that's great. There's been such rich conversation. This is the last of the events for this learning exchange and for the learning exchange in the learning community for this series. And we're really glad to be with you here today. My name is Jane Pfeiffer. I'm a program director at the Center for Children and Family Futures, where I've worked here for about the last 10 years. My background is in court administration and community supervision. Early in my career, I was a probation officer here in Northern California, and I later worked for the Superior Court here in California. And since then, my work has been focused on supporting communities, counties, states, and tribes implement and strengthen their multidisciplinary cross-system collaborative work to really look at their practice to better serve children, parents, and families. I'm glad to be here today, and I really look forward to hearing from all of you. I should also say that my colleague Kelly Jones had a family emergency, and so Alexis Balke is stepping in for her. So Alexis?
Sure, thank you. Yeah, so my name is not on the slide, but I am thrilled to be here today. I've heard so much about the great work that's happening through the Second Chance Act and the collaboration between us and the Justice Center. So really thrilled to be here today. My background is in treatment. I used to run an intensive outpatient treatment clinic, as well as therapeutic behavioral services, parenting programs, and did some court administration, really through the coordination of a treatment court. So I'm really excited about this. I'm excited about all things family-centered, and similar to Jane, for the last 10 years or so, working for the Center for Children and Family Futures, really trying to help communities, states, tribes, build collaborative infrastructures to help support the full family, and just really excited for the conversation today. And thank you for having me here.
Hi, everyone. I'm Ariel Andrews, and good morning or good afternoon, depending on where you're joining us from. So excited for you to be with you all today on Tuesday, 2/22/22 at 2 p.m. So we planned that well. I've been with CFF for a little over a year, and my background is working in family treatment court and also being a probation officer, working with high-risk, high-need populations, reentering the community from incarceration, getting that family center services and treatment. So really excited to be with you all today and wrap up this series. It's hard to believe it's already been 6 months. So I will hand it back to Alexandria.
Thank you, Ariel. Next slide, please. Okay, so the Council of State Governments Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association serving state officials in all three branches of government with policy and research expertise to develop strategies that increase public safety and strengthen communities. Next slide. So our goals are to break the cycle of incarceration, improve health opportunity and equity, and expand the knowledge base of what works to improve public safety. Next slide. The Second Chance Act, which was passed in 2008, supports units of government in reducing recidivism and improving outcomes for people leaving incarceration and returning to their communities. The Second Chance Act has supported over $300 million in reentry investments across the country. The Bureau of Justice Assistance is the funder of the Second Chance Act grants. And so here you can read their mission statement. And I don't think we have anybody here from BJA today, but I'll give you an opportunity to read that if you want to. Okay, so at this point, I will turn it over to the presenters for the Center of Children and Family Futures. Oh, actually, no, it's still my part, sorry. So we'll do our grantee roll call and we'll see which grantees are present with us for the learning community today. So if you don't mind, please type in the chat your name, your title, and your organization. If there are multiple people watching with you, we just ask that you list everyone's name and title in the chat so we know who's all here. Okay, we have Washington Department of Corrections. Katie Hales from Kansas. Johnny Turner from Franklin County. Is that Ohio? And we have Indiana, Kansas, Beaver County, Pennsylvania. Yes, okay. Thank you, Johnny. All right, and you all can keep entering that into the chat. So now I will turn it over to the Center for Children and Family Futures, and they will begin discussing the presentation for today.
Okay, thanks again, Alexandria. And welcome everyone. Please keep dropping in the chat where you're from. It's good for us to know. It looks like we've got some folks from New Mexico and Alaska. So excited to see everybody rejoining today. So just a brief overview of the Learning Community series. We've had 3 90-minute sessions with concentrated content and opportunities to engage in Q&A and discussion. And then we've had this is our third 60-minute peer learning exchange where you guys are coming together to share your successes and challenges as you implement a family-centered approach, as well as any opportunities to get questions answered and learn from your peers. So excited to be with you all today. Our first learning community session took place in September. We spent time during that session to lay the foundation for family engagement, talking through the research that shows family engagement improves outcomes and provided you with some concrete strategies to become more family-centered in your approach to this work. Our second learning community session took place in November, and that provided an overview of family engagement within the context of a continuum of care. So while doing a deep dive into building your collaborative capacity and looking at cross-agency collaboration to integrate those family-centered approaches into your services and initiatives. And then our third and final learning community session took place back in January, and that focused on using a family-centered approach to improve outcomes for participants and their families, and included strategies to engage families from incarceration through their post-release reintegration. So all of these sessions were recorded and are available to you if you were unable to attend. So if you need access to those recordings, just let us know. Today is our final peer learning exchange. So we've had 3 of these as well. And as you can see, based on this timeline, it's hard to believe we've been with you all for 6 months. So we started just back in September, and we're wrapping up our final session today in February. So here are the learning community goals and objectives. So seeing that consistent participation, which I think we've had pretty good participation throughout, working on advancing the skills of grantees related to family engagement, engaging with other grantees to share your experiences and lessons, enhancing knowledge and trends and development of family-based treatment, and then asking questions and sharing your successes and challenges. So the purpose of today's learning exchange is just to provide you all with a space and opportunity to ask questions, discuss barriers, and share successes. So we recognize some of you may be in the information gathering stage as you're working to develop a plan. Others of you may be actively working to implement your plan, but maybe you come up against some barriers. and others of you have overcome some of those barriers. So no matter where you are in your collaborative process, we really encourage you to engage in the discussion today. We're going to be talking through some breakout rooms, which we're excited to offer, and just excited to hear from you and how this work is happening in your community. So no matter how big or how small, we want to hear how things are going. So to get us started, I'm going to go ahead and offer an icebreaker. No annotate function this time. So if you want to come off mute and tell us to answer this question or drop it in the chat, you're welcome to do so. But our question is, if you could be great at any Olympic sport, no athletic ability required, which would it be? We thought this would be a fun icebreaker to get us started as the Olympics took place this month. And it doesn't have to be Winter Olympics necessarily. It could be summer or winter. Going to drop that in chat or come off mute and share that with us. We'd love to hear from you.
I think bobsledding would be pretty cool.
Bobsledding? Heard that one before. Mine would be figure skating. I've always thought that was so beautiful. Could never do it, not coordinated enough. Andrews of track and field.
No one's going to say luge. I think luge. That's what I want.
Alexis agreed with luge. Watching it on TV, I like that event. Cross-country skiing with shooting targets. Being a gymnast. Very nice. All right, well, in the interest of time, I'm going to go ahead and keep us moving. We're going to go ahead and launch our first polling question today. So this one is just gauging engagement up to this point. So Alexandria, if you don't mind launching that question for us. So Matt, no matter if you've attended each and every session, or maybe you haven't attended, but you've caught some of the recordings, or today's your first session, we just love to hear from you and how this has been going for you all so far. All right, I'm gonna go ahead and end the poll and share those results. It looks like either folks have attended sessions, attended some, or have caught the recording. So we don't have any first timers today, which is quite all right. We're happy that everybody can be here today. I'll go ahead and turn it over to Jane to walk us through a little bit of content before we do our breakout rooms.
Great, thanks so much, Ariel. I want to start with a slide that, as I can tell from the poll results, that many of you, if not all of you, should have seen before now by this point. I just have a few slides here, and I'm just going to spend just a couple of minutes really talking just a bit about coming back to the concept of a family-centered approach and how that fits in the work that we're doing. And so again, concepts that we've talked about before, that you all have talked about, and I really want to think about, when you look at this graphic and you think about the essential ingredients, just really how that foundation, that it's based on collaborative partnerships. You'll hear me say that a few more times today, and we've certainly said it all along, but really that no single agency can do this work alone, particularly when we're stepping back and really thinking about serving the entire family. And so looking at performance monitoring and funding, looking at case management, we know is such a key piece, and being able to think about the strengths and needs of not only the individual who's incarcerated or has been incarcerated, but stepping back and thinking about the needs of the family. And I said, I think when I first said it that you'd hear me repeat it, but I think in the first session, we talked about how the good news is that there are definitely partners in your community that can help you serve families, children, family members, and in all the ways that are necessary. So you're not expected to do it alone. So as we go to the next slide, a big piece, of course, of the work that we're doing is about the Continuum family-based treatment. And so thinking about treatment services, which is one piece or one part, if you will, of the overall family-centered approach. This graphic shows a continuum of family-based treatment services and the kinds of what's likely available in your community. Now, I live in a relatively rural area of Northern California, and we don't have a complete continuum of care. I've worked with many rural and frontier areas across the country, and I know that it's not that it only doesn't exist in your community, it doesn't exist in your county, it may not exist in your part of the state in some cases. And so it's really about taking a look at what the goals and the purpose is of each of these pieces and thinking about how to expand and enhance what does exist, and thinking about making a long-term plan to fill those gaps, which I know, of course, isn't easy. The good news, if there is some good news, there's more funding, federal funding available today to enhance specifically substance use disorder treatment than ever before. And so there are some opportunities perhaps that didn't exist in the past or didn't exist in the same way. Another reason to expand, certainly to expand our partnerships to really see how those dollars are being spent and how they can help to expand what's available in your community. So as we go to the next slide, I want to talk for a moment about the experience of trauma. And this has come up in some of our prior conversations here and with some of you in the peer-to-peer learning exchange, particularly. We know there are multiple effects on a child and their family when a parent's incarcerated. And that's, I'm not telling any of you anything you don't already know. Of course, it's the separation itself, but there are also other effects like you see on the slide, like social stigma and uncertainty about the future. And it's important to consider as you're thinking through how you're always continuing to look and expand the family-centered approach and the way that you're supporting families. But thinking about both the couple of items that you see on the slide and other experiences, how they affect children and being aware that they affect children differently depending on the child's age. And as you'll see on the next slide, the possible consequences or ways in which the experience of having an incarcerated parent can look very different from child to child. And that's true regardless. But then when you look at the experience of those children and their caregivers, the children based on their age, but just also when you look at this list here, there are many potential causes or contributing factors to the behaviors and the experiences that you see on the list. But you can probably imagine that some might be, I don't know, like misattributed or parental incarceration might not be immediately seen as the cause or the reason, the possible reason. And so it's important to think about trauma as, for instance, as we're working with families that have adolescents, that have teenagers, anxiety, irritability, social isolation, that's part of their job at that age often. And so how do we determine whether it's a trauma response, how it fits overall with what we know can be contributing to the experiences of not only children, but caregivers as well. So stepping back again and saying, okay, here are all the possibilities. Have we considered trauma as it relates to the incarceration of the parent? And are there opportunities for trauma-based services for the children, not only the children, but also caregivers? What's available in the community and who's prepared to be able to help them deal with those issues? So in the next slide, you'll see, again, a concept that we've talked about a number of different ways that I mentioned a little bit here just a couple of minutes ago, but really the idea that engagement is everybody's job, right? And when we say engagement, we really mean how do we get people to participate in services and supports, and how do we retain them? How do we keep them working with services and supports? And we've talked about given examples. Many of you have shared your examples as well about what this looks like. But just the idea that it starts at the first interaction, it continues throughout the entire time, the entire case, the entire time that you're working with the individuals, and that it's about long-term engagement that's required to lead to successful, to complete programs really, and to be successful in long-term successful outcomes for not only the parent, but for the children and the rest of the family. So we're going to be looking a little more deeply about family engagement here in the breakouts. We really want you to be thinking and sharing with each other about the things that you've learned. Again, you heard Ariel say the challenges and also your successes. And to do that, I'm just going to say a couple of last things. If we could go to the next slide, I want to say a couple of last things about considering how you work differently. If you can go to the next slide. Maybe having There we go. So we know the importance of working together, but how do we work together? Go back one slide. How do we work together differently? So it really doesn't matter what justice system you work in, if you're working in the criminal justice system, if you're working in one of the quality partners that the justice partners that may be, whether you are part of the, or perhaps you or one of your partners is part of the dependency court system, because we know that there's a lot of cross systems involvement with individuals who've been incarcerated, that their children are often involved in dependency court or the child welfare system. And so really thinking through the best way to serve the families that you are serving, the best way to be able to serve them, which is to take into consideration all the ways in which this can be enhanced or improved. And so we don't have time, although the recorded sessions from before will give you more of this detail, but thinking about substance use and child maltreatment, that they're often multi-generational problems that can be addressed through coordinated approach, that parental substance use disorders are often a factor, and we know that they're a factor in the majority of child welfare cases. And then research showing that a clear connection between a child's involvement in child welfare and the likelihood of their involvement in the justice systems as they age, so both as juveniles and adults. And so we want you to think more broadly. We know that all of the meetings, all of the collaborative work that you're doing, you don't want more people around that table just for the sake of having a bigger group, because nobody's got time for that, certainly. But we do know that when you can have the right partners at the table, when you can include partnerships that are representative of your community, when you think about the families that you're serving and how their experience and how the experience of individuals with lived experience can be included, whether it's in your steering committees, whether it's in your implementation teams, or the various ways that you're operationalizing the work that you're doing. Is it representative of the families that you're serving, and in what ways? Are you including community leaders? Are you including cultural leaders? What are the ways that what are all the ways in which you can make sure that the partnerships that you have are rich partnerships for the benefit of the families that you're working with? And then the last slide before we get into the actual peer-to-peer exchange part of our day-to-day is about meaning collaboration. And I want to just say one more thing. You've heard me talk about partnerships, the importance of collaboration. And I want to stop for a moment and say that often when we think about collaboration, it can be sometimes not very concrete. So what does it really mean when we say collaboration, and how do we go beyond collaborating to meaningful collaboration? And so I don't know about you, but when I participate in an exchange like this, you hear good ideas, you hear from others and what they're experiencing. And ideally, we want you to come away with some concrete things to do something differently when you get, you're at your desk, but, when you're back together with some of your other partners. And so we want you to think about identifying and agreeing on common values and a vision that's shared across systems and across partners. Enhanced collaboration and information sharing. Again, a concrete way to take a look at how are we sharing information appropriately and with the right confidentiality and releases in place, of course. How are we sharing information, whether it's results of assessments, of risk and needs assessments? How can we appropriately share that to enhance the case management and case planning that we're doing? Blending funding streams, lots more to discuss there that we don't have time about today, and also collecting data about shared outcomes. So what are the ways that we're currently doing that, and how can we really increase the work that we're doing specifically to that extent? And so what we're going to do now is we're going to move into breakout rooms. And I want to just, what you see on the next slide. No, Sorry, yeah. So these are the questions, and we'll drop these into the chat when we get into the breakout rooms. But these are the questions that we want to use as prompt questions, but there'll be three options of, excuse me, there'll be three options of breakout rooms that I'll talk about here in a minute. But we really want to hear from you about what is working for you, what isn't, what you can share with each other. And as we move into these breakout rooms, we're just going to have 20 minutes to talk in small groups. And then we'll come back into the main room. We'll ask that each small group specifically identify someone to report out, to just give a few of the highlights when we come back into the main room. But before we do that, I want to say one thing about a concept that we introduced earlier in this series that we called numbers, needs, and networks. And the idea that the first step really is identifying how many children are in the caseload, if you will. How many children is someone asking the question of the individuals maybe who are your identified client, if they have children under 18, if those children reside with them or not. So getting more of an idea about what the actual numbers are. And then the second step is around needs and what the needs are. And then ultimately those networks or those partnerships that can help meet the needs of all the families. So if you go to the next slide, we have 3 breakout rooms for you to select from, and there's no right or wrong answer, and we don't have these completely operationalized, but we hope they're somewhat self-explanatory. The first is early stage, and this is, we're asking you about applying a family-centered approach, where you really are related to that. So are you in the early stage? Are you in information gathering? Is it not perhaps a focus, but you acknowledge the importance of it, and so you want to find ways to do that, but you're not quite sure yet what they might be? Have you started implementing? Is it something either that's a requirement of your grant or otherwise you see the value of it, and so you've begun some implementation? And then the third breakout option is active implementation. You've been working at the family-centered approach for a while. You're well into operations. Not everything's in place. Not everything's been easy. No question about that. But that you've been doing this for some time. And so we want to break folks into those 3 separate groups. So we'll ask you each to select a group. So if you see the breakout room that says breakout rooms in progress, there should have been a pop-up on your screen if you scroll all the way to the bottom. So if you are able to click on your name and then click join at the bottom, you're able to join whichever one you would like to, and it will take you there, and then we'll come back. All right, any question? All right, see you in the breakout rooms.
See you soon.
Amy, do you see where it says breakout rooms? Like at the bottom? Don't see anything. I'm gonna see if I can assign you to one, okay? Which one would you want to go into? You see it? Okay.
Alexandra, can you assign me 2, please?
Yes, where did you want to go, Johnny?
It doesn't matter.
Okay, I'm going to put you in early stage then. Assign to early stage. And then Dawn, where do you feel like you should go? You're on mute, Dawn.
Possibly early stage as well. Thank you.
Okay, no problem. Okay. So for those of us we got left, Jerica, Michael and Arthur. I think you all come from Alabama. Do you all want to go into early stage? Oh, Arthur just assigned himself. Okay, I think Jerica did too. Let's see who we got left. Hi, Ariel.
I didn't have anybody in my breakout room, so I came back.
Oh, okay. Well, a lot of people are in early stage of implementation, but we got a
Okay.
few left. So, Melissa, where do you feel like you would best belong? Okay.
I'm gonna go ahead and join Alexis Balky in the implementation group.
Okay.
But if there's anybody that goes into the actively implemented, just let me know and I'll come back out and I'll go in that one.
Okay, that's fine.
All right,
Um,
thanks.
Julie, I think you might have just been joining. I'm not really sure. We're breaking out into breakout rooms according to where your program is. And so if your program is kind of like an early stage of just getting information about the family-centered approach, you would go into the early stage group. If you have actively, I mean, if you're in the implementation stage where you're just starting, you would go into implementation group. And if you've been doing it for a while and you want to go to active implementation, you could go into that group. Is there a group that you think you would want to go into, or would you like me to assign you into a group?
Yeah, active implementation. I'm stepping in for Julie.
Active implementation, okay. Going to, all right. Okay. And Jeff, how about you? What group do you think you should go into?
Whichever you feel is fine.
Okay, I'm gonna put you in the last group. Let's do that.
Thank you.
Uh-huh. Melissa, are you there? Not sure if it's gonna work.
All right, I'm about to leave out and go on one in early stage.
Okay.
Am I in the same room I was?
No, you left the room, but it's fine. I think you were finishing up like one statement with the implementation group.
Right. I'm not sure how that happened. It just said you need to leave, and I pressed the button and I left. Were
No,
you-
you're fine. If you want to wait until everybody comes back in, you can finish your statement.
Okay, so we're using a standardized parent observation form that was developed with me and RDA in terms of we think it's going to be a valid instrument. We will see. And so PIO facilitators will be watching JPay video visits and be using some data points there in order to capture if they're generalizing their learning from parents and the caregivers. And I think that's about it. The only thing I didn't mention, I told the other group, is we're leveraging existing IIBF funds to go beyond the 3 visit rooms that are targeted in the grant. And we're also doing visitation staff training, which will be statewide, and really try to bring more trauma-informed and engaging visitation staff to the visit room with perhaps more family-friendly look and a plethora of interactive activities. So that's it.
Thanks, Bruce, for, you guys hear me okay? Okay. Thanks everyone for coming back, and Bruce for finishing your thought. I know we lost the last few seconds of our breakout room. So I hope everyone had a good time in your breakout room. You're able to share some lessons and, you know, just kind of process through. So wanted to take some time to come back here at the larger group and just share what you all discussed, kind of those high level, high view points. And any takeaways. I don't know, Jane, do you want to start with your group for those report outs? And you're on mute.
Yes.
There we go.
Yes, I don't think we had an official person volunteer, so I'll go ahead and give a couple of high level points that were made, and then I encourage anybody else in our breakout group to add to it. So there were challenges that were discussed and shared and somewhat confirmed. Multiple people in the breakout talked about some similar challenges, particularly around working with fathers who had children, in some cases out of state, who weren't able to necessarily get in touch with, not only not see them, but not even be able to get in touch with a caregiver in some cases. There was some discussion about the inability to be able to access the jail. So the setting for the actual services, parenting, parenting classes, and supervised visitation, that just access to the jail itself has been challenging. And we talked just a little bit about how, and I'm paraphrasing here, so correct me if folks want to think of it differently, but it was challenging before COVID. Now that COVID's in place, you know, that now that we've had this COVID experience for a couple of years, it's that much more challenging. And I think also there seemed to be a recognition that, of course, that the jail is a different culture. And we also specifically, you know, you had heard me talk about incarceration, and we also spent a little bit of time talking about the difference between the jail experience and the prison experience, meaning when you're in prison, there's a much longer time for some services. There can be some continuity. And again, I'm paraphrasing, but there can be some continuity. There can be some just time to work with individuals. In the jail setting, not only are people coming and going more frequently, but they can be moved from pod to pod. And that alone causes its own set of challenges. There was also some discussion about figuring out how to work with dads or which dads to work with who have a domestic violence history, and whether it's a recent history or a remote distant history of domestic violence, and with whom and what that looked like, some challenges there. And And then we talked about identifying sites, communities where specifically where programs have been successful in a jail setting, and again, using jail specifically as opposed to prison. So breakout group, what did I miss? Anything else you would highlight?
Yes.
Please.
You did a great job though. Thank you for summarizing it. I just would want to bring home a little bit more of the fact that the jail population is so interesting and it's so dynamic. And I would be curious more from the funding and the federal side about coming up with different measures and a different type of outcome because of the nature of the jail. And just to give you the worst of examples, is that all over the country, you know, men and women are going into the jail and then they're coming out and they're overdosing and they're dying. And so that may be one instance in which that short period of engagement, if the child, if the family, if the household is not necessarily linked in to resources it may be available to them, then I wish that systems could talk a little bit more, and services could be those that need services could be identified more quickly, because, you know, like I said, it's a thing where, you know, we see it every week where someone has cycled in and out of the jail a couple of times throughout the year, and that one time, you know, they get out and they die, and you know, and I forgive me for being so blunt like that, but I'm just curious as to, with the jail population, is it a different set of measures or metrics or outcomes? Is it a worthy, sought after outcome to make sure that that child and the grandmother that child may be with knows about all of the resources that are in her particular neighborhood and may be on her bus line, beyond just her signing up for Ohio benefits and stuff like that? How can we make sure that child and that family, you know, is given access to the things that they need? So I'd just be interested in that.
Thank you.
All right. Sounds like you guys had a really great, robust conversation. I know we had that in our group too. So I don't know, Katie, if you want to share some of those high-level takeaways from our group as well.
It sounds, from listening, we had people, I know that Maria and I kind of work with the same population. She's with people in jail and I'm with the adult offenders. So what I heard from her, and also reiterating what I said, is a lot of our steps on trying to get family approached is referrals, trying to figure out the referrals we can get and the utilization of referrals. I know she's going into the jail, and, you know, so that's a little bit different on what services you can get into the jail and what services you can have. Just the reiteration of determining the number of the people on the steps to take, determining the people you need to help, building relationships. And then I also had put in there in regards to the data tracking that we discussed. And Laura had mentioned that they do a lot of pre and post tests in order to gauge if the services that are being offered, family services, they do a parenting class in-house, it sounded like, on if those are helping. And then trying to read my notes, it kind of scribbled a lot. But it seemed like the referrals were a big help on utilizing and reaching out to our partners on how we can get the families, because a lot of our stuff is not in-house stuff that we're doing ourselves, as we're making the referrals to those people, whether it's parenting classes, fatherhood initiatives, working with DCF, or we call them Department of Children and Families here, St. Francis, those type of things on, do they have children? Do we need to get those children back in the home, and what that looks like? That's what most of my notes say. So I'm sure I'm missing a lot.
No, I think you did a great job. Alexis, did you have anything else to add?
I know we're out of time, but I just wanted to emphasize that the fact that, you know, you're providing referrals out to the community, that's not, and not providing that in-house, that's just building relationships. That's building your relationship base. And then not just a referral source, but how do you build that relationship to have information sharing back and forth? And one of the barriers that was discussed was just challenges with co-parenting and parent coaching when there's domestic violence or other kind of restraining orders or safety issues in place, and how to work through that. I would suggest, just in hearing the amount of evidence-based programs and practices and interventions that we've just heard in this last few minutes and in our group, if whoever's kind of doing the notes can take a list of what everyone's using, I think people would really benefit to hear from what other grantees are using within their community. It was a really robust discussion.
Great. Well, I do want to be respectful of time. We have a few last minute things to wrap up here. So if we can go ahead, Alexandria, can you launch the polling question for me? On this one, so this is asking about what your team is doing to actively implement a family-centered approach in your community to improve outcomes. There we go. Looks like the poll just launched. Folks want to take a few minutes to.
And you can choose more than one.
Yes. So whether that's developing collaborative partnerships, looking at funding, outcomes, performance measures, looking at your services, maybe you don't know what it is your team's doing, so that could be a good time to start asking those questions, or maybe it's none of these that are on the slide, so feel free to drop that in chat if it's something other than that. So looks like we've got about half have responded, so I'll go ahead and share those results with everyone so you can see those. So we're a little bit all over the place, but that's a good thing, because that means we're seeing different ways that you're trying to improve those outcomes. So that's great. Go ahead and stop sharing and turn it over to Jane. Talk us through call to action.
Yeah, we're out of time, so I'm not going to spend much time other than to say that we always want, from whether it's a learning exchange or one of the other learning communities, that you come away with something concrete, perhaps that you'll do differently. And it doesn't have to be a huge thing, but we really would like to have the information that's on this slide for you to consider, the kinds of things that might be a next step for you, or something that you can talk to your partners about, for instance. So we encourage you to take a look at that list and things you've heard from your partners as well.
Great.
And we have, Ariel, I know we have resources, but I think we're going to have to leave that for another time. Yeah. All of these will be available, though. The slides will be available to you.
They will. We'll be sure to make sure these get out to you all. And the last thing, we did highlight some new trauma resources, so I want to bring that to your attention. And then the last piece is just, if you want to stay up to date on any trainings or resources coming from the Center for Children and Family Futures, to join our listserv, you can drop your email in the chat if you'd like to do that, or you can follow the link on the slide and also visit our website. So that's a way to stay up to date on any trainings or resources being released by the Center for Children and Family Futures. And with that, I'll hand it over to Alexandria.
Thank you all for participating in this event and the series. And so this session today concludes the Learning Community series and the peer exchanges. So following this event, you will receive a survey asking about your overall experience in this Learning Community series. We just ask that you please complete it at your earliest convenience. And if you didn't get any of the previous recordings and you would like those, please feel free to reach out to me. Following today's recording, once it becomes available, the recording and the slides will be sent back out, and it will be on the same handout as all the previous recordings. So you'll have access to those recordings in the future. If there's any questions, comments, or concerns, you can feel free to reach out to me via email. And other than that, we appreciate you all joining, and we hope that you all gained a lot from this experience. Thank you.
Thanks, everyone.
Everyone.